Have you ever been sleeping peacefully when a sudden, sharp pain in your leg forces you to wake up? Within seconds, your calf becomes so tight that even moving your foot feels almost impossible. If this has happened to you, you're not alone. Nighttime leg cramps affect millions of people around the world. While they often last only a few minutes, the pain can be intense enough to interrupt your sleep and leave your muscles sore even after the cramp is gone. Many people believe these cramps are simply a normal part of aging. But that's not always true. In many cases, your body may be responding to dehydration, mineral imbalances, nerve problems, poor circulation, or other possible causes. The good news is that understanding the possible cause is the first step toward making informed health decisions. Some simple daily habits may help, while other situations may require medical evaluation by a healthcare professional. In this video, we'll explain 8 possible reasons why your legs may cramp at night, along with practical tips that may support healthy muscles and signs that shouldn't be ignored. Let's get started. A nighttime leg cramp is a sudden, involuntary tightening of one or more muscles. It most commonly affects the calf, but it can also occur in the foot or thigh. The pain may be brief, but it can feel surprisingly intense. Although the cramp usually lasts only a few seconds or minutes, the muscle may remain sore afterward. Some people experience leg cramps only occasionally, while others may notice them several times a week. The important thing to remember is that leg cramps don't always have the same cause. In different people, they may be linked to hydration, nutrition, circulation, nerve function, medications, or other health factors. That's why it's important not to guess the cause based on symptoms alone. Understanding the possible reasons can help you ask better questions and know when it's appropriate to seek medical advice. Let's begin with one of the most common possible causes of nighttime leg cramps, dehydration, and see how not getting enough fluids may affect normal muscle function in some people. One of the most common possible causes of nighttime leg cramps is dehydration. Your muscles need enough water to contract and relax properly. When your body doesn't have enough fluids, normal muscle function may be affected, increasing the chance of cramps in some people. Dehydration doesn't happen only in hot weather. It can also develop after heavy exercise, excessive sweating, fever, vomiting, diarrhea, or simply not drinking enough water throughout the day. These situations may reduce the fluid your muscles need to function normally. Water helps deliver nutrients and supports the balance of minerals inside muscle cells. When hydration levels fall, muscle cells may become more sensitive, making sudden tightening or cramping more likely in certain individuals, especially during the night. Older adults may be more likely to become dehydrated because the natural feeling of thirst can become weaker with age. Some medications or medical conditions may also increase the risk, making good hydration even more important. Drinking enough water throughout the day may help support healthy muscle function, but dehydration is only one possible cause of nighttime leg cramps. Next, let's look at another important factor that many people don't think about: low magnesium levels. Magnesium is an important mineral that helps your muscles and nerves work together properly. It supports normal muscle relaxation after every contraction. If your body doesn't get enough magnesium, some people may become more likely to experience muscle cramps, including during the night. Magnesium helps control the signals between your nerves and muscles. When magnesium levels become too low, these signals may not work as smoothly, making muscles more likely to tighten unexpectedly in some individuals. Low magnesium may develop for different reasons, including not getting enough magnesium-rich foods, certain digestive conditions, or the use of some medications. However, only proper medical testing can confirm whether your magnesium level is actually low. Foods such as spinach, almonds, pumpkin seeds, beans, and whole grains naturally contain magnesium. Eating a balanced diet may help support healthy magnesium levels and normal muscle function over time. While magnesium is important, it's not the only mineral involved in healthy muscle function. Another mineral called potassium also plays a key role, and low potassium may be another possible reason behind nighttime leg cramps in some people. Potassium is another important mineral that helps your muscles, nerves, and heart work properly. It plays a key role in sending electrical signals that allow your muscles to contract and relax normally. When potassium levels become too low, muscle cramps may become more likely in some people. Your body can lose potassium through heavy sweating, prolonged vomiting, diarrhea, or the use of certain medications. Eating too few potassium-rich foods may also contribute to lower potassium levels over time in some individuals. When potassium levels are lower than normal, communication between your nerves and muscles may not work as efficiently. As a result, the muscles may become more sensitive, increasing the possibility of cramping, weakness, or muscle fatigue in some people. Many healthy foods naturally contain potassium, including bananas, sweet potatoes, spinach, avocados, beans, yogurt, and oranges. A balanced diet may help support healthy potassium levels, but supplements should only be taken if recommended by a healthcare professional. Even if your hydration and mineral levels are normal, leg cramps can still happen. Another possible cause involves the way blood flows through your legs. Let's look at how poor circulation may contribute to nighttime leg cramps in some people. Your muscles depend on a healthy blood supply to receive oxygen and nutrients. If blood circulation becomes reduced, your leg muscles may not get everything they need to function normally. In some people, this may contribute to nighttime leg cramps or muscle discomfort. Reduced circulation may happen for different reasons, including narrowed arteries, long periods of sitting, smoking, or certain medical conditions. When blood flow decreases, muscles may receive less oxygen, especially during rest or while sleeping. Poor circulation may also cause other symptoms in some people, such as cold feet, numbness, tingling, slow healing wounds, or pain while walking. These symptoms should not be ignored and deserve medical attention if they continue. Regular physical activity, avoiding smoking, and managing conditions such as high blood pressure, diabetes, or high cholesterol may help support healthy circulation. Always follow your healthcare professional's advice for your individual situation. Healthy circulation is important, but blood vessels aren't the only part of the body involved in muscle movement. Your nerves also play a major role. Next, let's explore how nerve compression may contribute to nighttime leg cramps in some individuals. Sometimes, the problem isn't in your leg muscle at all. The nerves that control your leg muscles begin in your lower back. If one of these nerves becomes compressed or irritated, it may contribute to leg cramps, pain, or unusual sensations in some people. Nerve compression may develop because of age-related changes in the spine, a bulging disc, arthritis, or spending long hours sitting in the same position. These conditions don't always cause cramps, but they may affect the way nerves communicate with your muscles. When a nerve becomes irritated, you may notice more than just muscle cramps. Some people also experience tingling, numbness, burning sensations, muscle weakness, or pain that travels from the lower back into the leg. If leg cramps are frequently accompanied by numbness, weakness, or pain that spreads down the leg, it's important to seek medical evaluation. A healthcare professional can determine whether a nerve problem or another condition may be responsible. Nerves are only one part of the picture. Certain prescription medications may also increase the likelihood of leg cramps in some people. Let's look at another possible cause that many people don't expect. Sometimes, nighttime leg cramps may be linked to certain medications. Not everyone experiences this side effect, but some medicines can affect your body's fluid balance, mineral levels, or muscle function, making cramps more likely in certain individuals. For example, some diuretics, cholesterol-lowering medications, or other prescription drugs may contribute to muscle cramps in certain people. However, this doesn't mean everyone taking these medicines will develop leg cramps. Never stop taking a prescribed medication on your own because of muscle cramps. If you think a medicine may be causing new or worsening symptoms, speak with your healthcare professional before making any changes to your treatment. Your healthcare professional may review your medications, check for possible interactions, or recommend tests to determine whether another condition could be contributing to your leg cramps. Finding the correct cause is the most important step. Not every leg cramp is related to dehydration, minerals, circulation, nerves, or medication. In some cases, an underlying medical condition may also play a role. Let's explore another possible reason that shouldn't be overlooked. Sometimes, frequent nighttime leg cramps may be linked to an underlying health condition. While cramps alone cannot diagnose a disease, they can occasionally occur alongside conditions that affect your muscles, nerves, or circulation. For example, diabetes may affect the nerves over time, while kidney disease or thyroid disorders can sometimes influence the balance of minerals and fluids that healthy muscles rely on. These are only possible connections and require proper medical evaluation. If your leg cramps happen frequently and are accompanied by symptoms such as unusual fatigue, swelling, numbness, muscle weakness, or changes in urination, it's important to arrange a medical checkup rather than trying to diagnose yourself. A healthcare professional may recommend blood tests, a physical examination, or other investigations to better understand the cause of your symptoms. Identifying the correct reason allows the most appropriate treatment plan to be developed. Fortunately, many people can also reduce their risk of nighttime leg cramps by practicing healthy daily habits. Let's finish with several simple lifestyle tips that may help support normal muscle function and overall health. Although nighttime leg cramps can't always be prevented, several healthy daily habits may help support normal muscle function. These habits won't guarantee that cramps will stop, but they may reduce the risk for some people when practiced consistently over time. Drinking enough water, eating a balanced diet, and staying physically active may help your muscles work more efficiently. Gentle stretching before bed may also help some people reduce nighttime muscle tightness, although results can vary from person to person. It's also helpful to avoid sitting or standing in the same position for very long periods. Regular movement throughout the day helps keep your muscles and blood circulation active, which may support overall leg health and comfort. If your leg cramps become more frequent, more painful, or are accompanied by swelling, weakness, numbness, or changes in skin color, don't ignore these symptoms. They may require prompt medical evaluation to identify the underlying cause. Understanding the possible causes of nighttime leg cramps is the first step toward making informed health decisions. By paying attention to your symptoms and seeking medical advice when needed, you can take positive steps to support your long-term muscle health. Today we've explored 8 possible reasons why your legs may cramp at night, from dehydration and mineral imbalances to poor circulation, nerve compression, medications, and certain health conditions. There isn't always one simple explanation. Remember, occasional leg cramps are common and often harmless. However, frequent, severe, or persistent cramps, especially when combined with weakness, numbness, swelling, or changes in skin color, should be discussed with a qualified healthcare professional. Healthy habits such as staying hydrated, eating a balanced diet, remaining physically active, and following your healthcare professional's advice may help support healthy muscles and overall well-being. Small daily choices can make a meaningful difference over time. If you found this video helpful, please like, subscribe, and turn on notifications. At VitalBites, we publish new evidence-based health videos every day to help you better understand your body and make informed health decisions. This video is for educational purposes only and is not intended to diagnose, treat, or replace professional medical advice. If your leg cramps are severe, persistent, or accompanied by other concerning symptoms, please consult a qualified healthcare professional for a proper evaluation.